Everyone dreads coming into the hospital. The wait times in Emerge are insane. You don't know if you're going to be there for a few hours or a few days or even a few months. The vampires come out to suck your blood. And the food is, well, you know how the food's like. I've put together my top 5 tips to make your next hospital stay smoother and get you home as early and safely as you can. Hi, if you're new here, I'm Herb the Heart Pharmacist, and I go over heart medications to help you choose and use wisely. Number 1, bring a medication list, and not just the names of the medications. We want to know exactly how you've been taking it at home. Have you been doubling up? Have you been taking half a pill? Have you been taking things every other day without the doctor knowing? How often you forget to take your medications? How often you use those medications that you take on an as-needed basis, like your Ventolin puffer or your Ativan? Have you missed any important medications recently, like any blood thinners? This also includes over-the-counter type medications, supplements, natural health products, vitamins, traditional Chinese medicines, any creams, puffers, ointments, samples from doctors, medications you've been borrowing from your neighbor or partner, non-prescription medications such as anti-inflammatories like ibuprofen or naproxen, or decongestants like phenylephrine and Sudafed. If you can give us a name and contact information for the pharmacy that you typically deal with, that deserves an A+. If you made it this far into the video, I want you to hit the pause button right now. Go grab a piece of paper and write down each one of your medications on a piece of paper, as well as the strengths, how many tablets you actually take, and how often you take these things. And here's the secret sauce. I want you to leave one last column at the very end to make note of any issues that you've been having with that particular medication. Have you been excessively dizzy on this one particular medication? Does it make your heart race? Does it cost too much? Does it have a weird aftertaste that makes you feel nauseated? Do you forget to take this particular medication? Sometimes we can help with these things while you're in the hospital. But if we can't get to it, just make sure that you bring it to your family doctor's attention as well. Number 2, be clear on your allergies to medications, supplements, adhesives, and all those types of things. And to clarify, an allergy is not something that makes your tummy upset. That is what we call an adverse drug reaction or an intolerance. A true allergy is something that is immune related that often leads to a rash, itchy hives, and in more serious cases can lead to things like swelling of the tongue, swelling of the eye sockets, difficulty breathing and closing of the airways. Antibiotics, peanuts, tree nuts, bee stings, shellfish are often culprits for this type of reaction and needs to be documented in the medical records. Please also make note of anything that you cannot take for any religious reasons as well, such as things that contain pork, as some of the medications we have are actually derived from pigs, as well as anything like blood transfusions that you can't have, etc. Please do not tell us that you have an allergic reaction to something that your friend or family member had an allergic reaction to before. You'd be surprised. This has actually come up a few times. If it didn't happen to you, it has not happened. Number 3, be ready to talk about and make decisions on changes in goals of care. Ask yourself, do you want to receive chest compressions in the event that your heart stops? Do you want to have a breathing tube down your throat and into your lungs to help you breathe and be put on a ventilator? These things matter to me as a pharmacist because it helps me focus on what actually matters to you, not what the doctor thinks you want. Number 4, move your unless you're physically unable to for whatever reason. Say you came in, you fell, you fractured your hip, and you have a wire down your neck for complete heart block and you're confined to a bed. Please try your best to move around in the hospital, either in your room or on the ward. Go chat up your nurses if they're looking like they're free. Very often, patients will be put on blood thinner injections in the hospital for fear of blood clots in the legs that can migrate up to the lungs that can cause serious breathing problems and worst case scenario, a cardiac arrest. These things are not comfortable for patients and can be kind of expensive for the hospital. And people sometimes can bleed quite a bit from them, particularly at the injection sites. The earlier you can prove to us that you can move your butt and be strong and steady enough to go home, the earlier we'll feel comfortable about stopping these injections in your belly. 5, not only is it important to maintain your physical capacity while you're in the hospital, but your cognitive capacity or your mental health is just as, if not more important, to prevent things like deconditioning of your brain or delirium where your mind may play tricks on you. I know it's boring in the hospital. And even though most hospitals now will have internet access, I do encourage you to try to use your brain a little bit more than just say lie there and watch a Netflix series. So if you know that you're going to be in the hospital for a few days or maybe even a week or so, I do encourage you to either go get a book, get some magazines, start writing in a journal, start a new crafting project, or even start a YouTube channel. Make time to go practice meditating or do some light stretches, or heck, even do some yoga in bed. Phone up a few friends. Listen to an audiobook. Also, try your best to limit screen time, particularly the hours leading up to when you're supposed to go to bed. With all the bells and alarms ringing and various other things that are happening on the unit, I know it's very difficult to fall asleep. Also, try your best to keep the lighting in your room to reflect normal daytime and nighttime hours as well. We want to avoid having to use sedatives or things to help you sleep as much as possible, because those things are associated with things like falls in the middle of the night, etc. I hope you implement some of these tips the next time you or a loved one gets admitted into the hospital, and let me know in the comments below if you found any of these things are helpful or anything else that you think I should have mentioned. Thank you all for watching, and we'll see you in the next one. Say no to drugs.